Hey guys, welcome back to Practical Therapy. I just want to start out by saying thank you so much to all of the warm welcoming and outpouring of comments and likes and shares that you guys have given. I announced this video yesterday at 3 p.m. It's like 1 or something, so it's been less than 24 hours, and videos have already reached over 800 views between the two of them, and reached over 1,500 people. And I just want to thank you guys for the support and the encouragement and the comments and the messages. I've been getting some really cool messages about ideas for topics, so I'm starting to sort through those and have some ideas. But anyways, today I wanted to talk about a topic that I think is overlooked by our culture, and it's a topic that it's a concern in mental health that I think is overlooked, and our culture, I think, even perpetuates this problem. So not only does our culture overlook this problem, but I think it also creates this problem. And that is the concern of mental health. So, anxiety. Sorry, I said mental health. I meant the concern of anxiety and mental health. So there's two different ways you can look at it. One way you can look at anxiety is kind of the way I look at it for me personally, the way that I experience it, which is just, it kind of pops up periodically in my life. So I would not give myself a diagnosis of generalized anxiety, but I would definitely say I struggle with it from time to time. And I think a lot of us can say, I've been anxious before. There's been times in my life I've been anxious. But then there's some of you that actually could be diagnosed with generalized anxiety. And that is when it's persistent every day in your life in some way, shape, or form. You feel it physically, you feel it emotionally, you feel it mentally, and it's a really big burden. And the problem with our culture is we kind of shame people for it. We try and minimize people often for the anxiety, like, oh, don't worry about it, I think is what people say too often. And so people have learned to keep their mouths shut when they're feeling anxious. And that's really, really, really sad. Because the truth is this is real. This is a real issue that they're struggling with, and they're being told it doesn't matter. Their issues being minimized, and that's the last thing we want to do with people struggling with mental health, is make them feel minimized and ashamed for it, because that's not how we help and love and support people through things. So, well, glad I'm giving you some tips, Heidi. Welcome to the show. Anyways, so these are some practical tips. These are tips that I actually will tell. So when a client comes into me and they're like, I need to deal with my anxiety, these are going to be some tips that I give them. And this is the thing. These tips that I'm going to be giving, these techniques that you can use, are for people who struggle with it every day and are for people that struggle with it periodically from time to time. Now, I do want to encourage people that struggle with it significantly. You can go get help. Do not be embarrassed. And the good news is like, I can think of 3 people off the top of my head that have come to see me for anxiety, severe, significant anxiety, and the longest person needed 15 weeks, and that was fairly long, 15 weeks. But another female came to me and she only needed 7 weeks, so that's only 7 sessions. That's not super long. So if you try these techniques and you're not seeing any relief from these techniques, don't be ashamed. Call up a therapist in your area and get some help. And you'll be so thankful you did, because something that you thought you had to struggle with every day of your life forever, you'll realize, oh my gosh, I don't have to deal with this forever. Someone can come alongside, help me, support me, encourage me, and teach me the skills I need to be able to get through this. All right, so let's get to the techniques, because I am blabbering. Okay, so the first step you want to do is you want to put it on a scale of 1 to 10 of how likely is this really going to happen. So how likely is this concern? Let's say I've got a meeting coming up, all right? And I've got to meet with an insurance company. This is, anxiety hits me on this level, so I'll use me as a personal example. So I've got to meet with an insurance company, and I have got to make a case for my client so they do not cancel therapy, and they do not cancel insurance payments for my client. That's a lot of pressure, right? So I have a lot of anxiety about, I have to do this right, I can't let my client down, I got to know everything on this case, I got to be able to advocate. So I got a lot of anxiety of a lot of pressure I got to do. And then my worries are, what if I let this client down? What if I don't know the answers? What if I look stupid? What if I look like a fool? What if I look uneducated? What if I look like a fraud? All of these questions, right? So I need to stop doing that shoveling that I was just doing, where I'm like going through negative over and over, just shoveling and piling it on me and burying myself underneath it. I got to stop that. And I have to take it one at a time and think about, okay, I'm worried that they're going to think I look like a fraud. On a scale of 1 to 10, how likely is that? Probably like a 2. They're not going to look at me and think that I'm a fraud. So I'm not going to necessarily get a plan together for if that were to happen, because that's less than a 6, okay? The next thing I'm concerned about is if I don't know the answer to every question. That's like an 8, okay? That's probably going to happen. They're going to ask me questions, and I'm not going to know the answers to that. So since that's higher on the scale, let me think of a plan. What am I going to do for when that happens? I'm going to be honest with them, and I'm going to say, I don't know the answer to that question, but I'm going to do my best to try and answer it, and then I will try and find other ways to continue to make the case for my client. All right, so that's my plan for that concern. Next concern. So with anxiety, slow it down, because we go in and we just bury ourselves under the fear and under the anxiety and under the panic, and we don't stop and we don't think. So stop, think on a scale of 1 to 10, how likely is this to happen? And then if it's a 6 or higher, then you make a plan for it. Even, you know what, you can make a plan if it's a 4 or if it's a 5. Do what works for you. For me, I usually make a plan if it's like a 6, 7, 8, or 9, or 10. That's when I start to make a plan. Do this with someone that loves you and cares about you. You don't have to do this on your own. A lot of times when I'm nervous about something, I will go talk to like my supervisor. Man, I'm in her office all the time. I'm like, I'm panicking, Lori. What do I do? And we talk through plans of what I would do if this were to come up. So you can have this conversation with someone who loves you, someone who supports you, and will listen to you and encourage you and give you ideas of how to handle things. But if you don't have someone to talk with, this is still something you can do on your own. And it's something, if it's helpful, you can write it out, because for a lot of people, it's very therapeutic to write things out. So you can write it out as well, if that's helpful for you. So that's that's one major first step in anxiety, is to slow down. Don't let all of the negativity just shoot through your mind. Stop it. Take it one at a time, one concern at a time. One concern at a time. How likely is it to happen? All right, it's pretty realistic, then I'm going to make a plan for it. If it's not really realistic, I'm just going to hope to God that it don't happen. Just don't make a plan for every single scenario, because that would wear yourself out. Okay, so that is pretty much my my piece. Again, like I said, I'm talking about an issue that I think that our culture overlooks. We have a culture that is all about looking perfect, having it all together, doing all, being all, having all, keeping up with the Joneses, making more money than you need to make, being able to do all of this. Our culture puts so much pressure on us from every single angle that we look. So it's easy to have a lot of anxiety in every area of your life, as a mom, as a spouse, as an employee, and so I think that it's important to recognize that our culture puts a lot of pressures on us, and sometimes stopping and realizing, I'm not going to let my culture do this to me. I'm not going to let the American individualistic culture of it's all me by myself, I'm not going to let that affect me and bring me down. Realize that I think we're meant to live in community and in fellowship with others. And so when you're struggling in this on your own, reach out to other people. Don't try and do it all on your own. Don't try and to have all and be all. That's going to just make this worse on you. And lastly, I want to talk to the people who would not have a diagnosis of anxiety disorder. People like me, most people would not have the diagnosis of it. So I want to talk to you guys, and I want to say, do this for your friends and family. Do this for people that you know have anxiety. Support them and love them and encourage them through it. Do not minimize their anxiety. Don't shame them. Be there, listen to them, offer these techniques and these ideas, and love them through it. You can download this video if you have anxiety and keep it, on your phone and hit play, when you're having an anxiety attack. Or you can share this video to someone you know who does struggle with anxiety. Be like, hey, I saw this video, some helpful tips to help you out. I think that, when I was having my big anxiety about meeting with the insurance company, I forgot these techniques. Even though I sit and I talk with people about these, when you're in the moment, it's really hard to remember what to do. So I might download this video for myself. But downloading this video if you have significant anxiety and keeping it on your phone or on your laptop and hitting play next time you're having a panic attack, this might help bring you back to what you need to do to be able to find some relief. Okay, I think that is everything for today. I'm trying to keep these videos short and concise. Of course, with anxiety, there's like this much to talk about, but I can't keep you guys all on here forever because nobody would ever even care about that. So I'm trying to take a lot of info. I'm trying to do this for you guys. I'm trying to hit the surface, but still make it be good content and make it still matter for you guys. So I hope it wasn't too fast. Hope it wasn't too short. Hope it wasn't too little. Hope it wasn't too much. All right, guys. Thanks so much for all the encouragement again and for tuning in. I'll see you later.